It's Mari McInerney from Croakey, and we're here at the Medicines Management Conference in Adelaide, and I'm here with an award winner. Adam, could you introduce yourself and your role, please?
Yeah, absolutely. My name's Adam Livori. I'm a cardiology pharmacist based out of Grampians Health, which is a regional part of Victoria, and a PhD candidate with Monash University.
You were actually called a force in cardiology. I'm not quite sure what that means.
Yeah, look, me neither. I'm yet to fully read that release and sort of get my head around all the wonderful things that people have said. I guess from my perspective, it's just been pursuing passion, and I've been fortunate enough that it's led to this honour.
And what was the honour? Can you tell
Yeah,
us?
so it was the 2024 Medal of Merit. So it's a national award given to someone who's made an exemplary contribution to advanced pharmacy Australia in the previous 3 to 5 years.
Fantastic. Now, you made a joke that went over my head in talking to the award, though, 3 sparks.
Yeah. So obviously, it would have been remiss as me as someone who's obviously both has degrees in pharmacy and nuclear medicine to not make a thermodynamics metaphor for my acceptance oration. And so I guess what we were talking about, the theme of the conference is it starts with a spark. And I guess the point that I was making in the oration was that while a spark might get something started, we need to appreciate that you're not going to propagate that reaction without a fuel source and without a source of air. And so the idea behind that was, taking the opportunity to thank the different sources of fuel that we use, whether it be through our work, our engagement with research, our engagement with professional societies or community groups, but also enforcing the importance of taking a breath and ensuring that we're recharging ourselves. As someone who has experienced burnout in the past few years, I think it's important whenever we're accepting these awards that we don't just look at the good, but appreciate that can come at a cost, and we need to embrace what that cost means.
What would your advice be around that, taking a breath?
Yeah, be open with your friends, and especially be open with the people who report to you. If you're fortunate enough to be in a position where people are relying on you and reporting to you, be vulnerable with them. Compassion needs to go both ways.
Now, you made the point that when you were doing your PhD, it was sort of quite a one day something, one day the next.
Yeah, I think a lot of clinician researchers could probably attest to this. You don't often start both at the same time. And so for myself, I was already in a senior cardiology clinical role when I decided to commence my doctorate. And so on a Tuesday afternoon, I would go from being the acting deputy director or clinical lead of the department, and then on Wednesday, I was a biostatistics and epidemiology noob, struggling to make sense of how to, log on to the software, let alone build statistical models. And it was a really wonderful experience to almost go back to what it felt like just not knowing what you're doing. And so I think as a result, it's made me a better leader in being able to, I guess, relate to what that's like, because for a few of us, when we've been doing this for so long, it just feels ingrained. And so it's actually a nice way to sort of ruffle your own feathers to sort of work out where you need to go to next.
And you said it was also a really good lesson from your supervisors in transparency.
Yeah, look, I've just been incredibly lucky with my PhD supervisors, and in particular, one of my supervisor, Dr. Jed Morton, he's at the Baker Institute at Monash University, and then Lachlan Darley at the Stroke Foundation and Victorian Heart Institute. And both of them are very big on appreciating the idea of open source science, and about, in a world where everyone is trying to create solutions in a black box, the idea of putting everything out in the open, being humble with your own inferences, and being skeptical even of your own work. And I'll be talking about that later today at the conference, and providing an example of how I've tried to live up to those values in my research.
What will that be? Where you're presenting?
Yeah, look, I'll be speaking at sort of a twofer. So I'll be talking about principles of ethical data analysis, data linkage, and then showing how we can apply those principles into an application of a paper I recently published in Heart-Lung Circulation, which looks at patterns of medicines use in people following a heart attack, depending on whether or not they went down a surgical route or whether they went down the route where we've done an angiogram and placed a stent. And so the idea behind it is hopefully making statistical analysis more accessible, and also allowing people to appreciate that it is possible to be transparent in your methods and results if you're willing to take that extra step.
Fantastic. Now, takeaways from the conference?
I think for me, seeing a lot of my team at the hospital attending their first conference and seeing just how energised they are by it, obviously being humbled by this incredible award and honour. The people I've spent my career looking up to are previous winners of this award, and to know that I'm considered among them is incredibly amazing. And I'm really excited to continue to give back to the organisation.
Fantastic, Adam. Thank you.